Cigarette smoking and surgical wound healing. That's the topic today. Compared to smokers, compared to non-smokers, the smokers has 2 to 3 times more chances of infection and wound dehiscence. That is 200 to 300% chance of increased wound infection and dehiscence. So that is why the doctors, especially the surgeons, before the surgery, the anesthesia also there is because during anesthesia they have a lot of complications. But the surgical part, the surgeon there that is always tell the patient to quit smoking at least 2 months. The best is 2 months or at least minimum 2 weeks. The reasons are all number one, nicotine is a powerful vasoconstrictor. So it's a over sympathetic overactivity. So the blood vessels go for constriction. So the blood supply, oxygen, nutrients cannot go freely. And not only that, the bad materials from the wound healing cannot come back. So chances of infection, wound dehiscence is very high. And one, as I said, one cigarette smoke can cause constriction of the blood vessels for 60 to 90 minutes. So if you smoke 5 cigarettes almost throughout the day, it's vasoconstricted. The second reason is carbon monoxide. Carbon monoxide compared to oxygen has 200 to 250 times more affinity for the hemoglobin. So the carbon monoxide goes and gets attached to the hemoglobin, where suppose the oxygen is supposed to get attached. So even though the hemoglobin is normal, but oxygen is not attached, so the body will react as if they are all anemic, functional anemia. So anemia, definitely the wounding is delayed and it leads to more infection and more complications. So with the carbon monoxide, again smokers the same, they react like a anemic patient. The third, very importantly, the wound strength or the wound, the cells when they proliferate, when they develop, it needs fibroblasts and collagens. They are like iron rods in the building. So the fibroblasts production and type 1 collagen is production is very much reduced. So leading to wound dehiscence, strength of the wound will not come back. The tensile strength is very much reduced. So leading to even after 6 months, even after 6 years, this can cause hernia formation, wound dehiscence. All this can happen. The fourth one is very importantly the immunity. We need white cells to fight against the infection, especially the neutrophils and macrophages. With the smokers, the neutrophil function and the macrophage function is very much reduced, leading to when a bacteria comes or a virus comes or any pathogen comes, the neutrophils and macrophages they don't do the job, so chance of infection is very high, especially a plastic surgery. All these things leads to easy infection, graft rejection. The same way, the cigarette smoking causes endothelial injury. That means the inner layer of the blood vessel is damaged, so platelets get aggregated, leading to thrombus. So like they will block the blood vessels. Again, no oxygen, no nutrients. Again, infection. So cigarette smokers compared to the non-smokers, 2 to 3 times more chance of infection and wound dehiscence. The same way, they also have an effect more on the anesthesia part. They can cough. So after the surgery, if they cough, the wound can uh, get burst open. So these all can happen. So before the surgery, at least the best is 2 months or at least 4 weeks. If an emergency or semi-emergency, at least for 2 weeks. Don't most of the people alternative they do, I will quit but I will have a nicotine patch. Nicotine patch still is as bad as your smoking. Thank you.